Did anyone else have the craziest like yoga since hearing Heather talk? It was like the weirdest experience this morning, right?
I in every Saturday morning to a yoga class, and I kept thinking, wait, she's talking about the arm, but I'm thinking about the arm, and that was really neat.
Right? Like, oh, the whole time I was like, oh, that's so weird.
I love that connection. That's really I agree. You start thinking about all these. You start thinking about all these things that you do outside of conducting, outside of music. Part of your. Oh yeah, that's how that. Oh wow, that's much easier. Yeah, I had that revelation when I was on a rowing machine, and I was thinking about head movement.
Oh,
Oh, this is much easier. Oh, this
cool.
is faster. Oh,
That's so cool.
really
I
cool.
love that.
That's awesome. Yeah. So I think on so many different levels we're making all these connections and through this context of movement and gesture and movement of balance, and then I think today movement of breath. That's really exciting. It's gonna be very cool. See, I'm seeing some other folks. Yeah. All right. Hey. Hi, Dr. Buchanan. Good morning.
Hey, good morning. You guys can just call me Heather, you know. I mean, I appreciate it. I worked hard for that doctorate, but
Yeah.
I feel like we're all friends. So, you know, students can call me Dr. Buchanan. People in my age group just call me Heather. That'll make me happy.
Thank you. Thank you.
I was just listening to the yoga comments, Anna and Brenda, and I love it. When I first started learning about body mapping, I was actually weightlifting. And it was amazing how the process of learning to do that really helped me get clear about structure, about form, about balance, because let me tell you, you are not putting your body weight on your shoulders and doing a deep squat unless you have, you know, perfect alignment. So yeah, there's, you know, anytime you can apply this information to your everyday life, you're on a winner. You really are. And in fact, I've got articles about how yoga can hurt you, and I've got articles about how yoga can help you in the same way that exercise. You know, if you're using the wrong form, you will injure yourself, right? So just because you're doing yoga doesn't automatically magically make you safe or well, right? So anytime you can take this information and put it into another context, you're better off for that, without a doubt. Yeah. So Max, 2 of my ACDA chapter here, Alexa, our president, has ventured back. Thank you, Alexa. And my Eric, you remember the other week we were joking about Eric's.
Yes.
So Eric Van Hoven meet Eric Ness. I was sending texts to Eric Ness that were meant to go to Eric Van Hoven. So
That's funny. Well, welcome, Alexa and Eric. We're glad that you're here from the other side of the country. Well, this is one of the great things about doing a virtual conference is we can connect with people from longer geographic distances and be in the same room. So that's brilliant.
Absolutely. So did anybody who's here have any other comments or questions they want to address while we're waiting for the rest of the folks to join in? I'm happy to engage if anybody wants to make good use of that time, if it avoids those awkward screen silences.
If you could talk a little bit about how you got into this, because there must have been something that caused you to be curious.
Yes. Hey, that's a really great question. And nobody's asked me that for such a long time. Okay, I'll check the clock. I'll give you the quick answer. And then, you know, I'll give you the long answer over adult beverages in the backyard tonight. So I've always been interested in bodies and how they work. And I think, honestly, if I'd had other experiences and I'd been more confident in myself as a human when I was younger, I might quite well have gone into chiropractic or something like that. I've just always had a fascination with the human body and how it works and sort of just understood those sorts of things. Anyway, when I came to Westminster Choir College 24 years ago to be a graduate student, I encountered a woman called Barbara Conable, who was the developer and the creator of this whole network of study. And I went to one of her workshops, and it kind of blew my mind, right? But what was more interesting was that in my teaching, two things happened. One, it was to me directly, personally, and I think I mentioned to you how I had that compression in the arm structure that made my hand go numb, and I could see it, but I couldn't feel it. And it was this weird thing. After 2.5 minutes, I can see my hand, and it's going a little trembly like this, and everyone's like, oh, that was so beautiful, and I'm just freaking out on the inside going, what just happened? Because numbness in your extremities can be a brain tumor, right? But I was fairly certain it wasn't a brain tumor after 2.5 minutes. So that got me a little curious. So off I went, and I thought, oh, I need to look at this. Then I was teaching conducting, and I was getting really frustrated with the fact that in auditions, we'd have people that would show up to audition, and I'd have colleagues say, oh, he can't or she can't hear anything, got no ears, no imagination. But I was like, how do you know this is true? And then I'm in a conducting class with a bunch of kids that I knew well. This was their 3rd semester. They all get up to conduct, and there's this student in the group who is, let's just say, he is a really nice kid, but intellectually and musically, he was the least switched on of everyone in the class. That's the way to put it, right? And all these other kids that are like the double major 4.0 GPAs, they get up there and they're all conducting, and they were train wrecks. They were absolute train wrecks, right? So there's all this stuff going on up in here, but there's all this stuff going on. And then our simple little friend gets up and he just starts conducting, and he got the best results of the day. This upends the class. How does the C student do better in conducting than the A students, right? And I'm just sitting there, and it hits me like a ton of bricks. His movement was connected. Although his ideas were simple, he wasn't getting in the way of himself and his concepts. All these other kids had tension. They were trying to imitate other people. They weren't breathing. This other kid just got up there and opened himself to sound and moved in ways that were very clear. And that for me, and then I'd been trying experiments with my choir. Joe Flummerfelt came up to me one day on the quad and said, what are you doing that's different? And I'm like, what do you mean? Because I didn't tell anybody what I was doing. I thought, if this information has any integrity, I'm going to do it, and people are going to notice a difference. And within a very short amount of time, like less than a couple of months, I had colleagues coming up to me saying, what are you doing that's different? The sound is beautiful. Students, sophomores, and you all know what sophomores are like. The sophomores were coming up to me saying, it's easier to sing for you than anybody else. And my voice doesn't get stressed. And even voice colleagues were, because I was the junior, I was the 5th of 5, right? And I had people coming up to me saying, what are you doing differently? I even had people sneaking up into my rehearsals and hiding in the balcony, watching what I was doing with the choir, right? They thought I didn't know. It was hilarious. And I just did not say a word. Anyway, one day Flummerfelt takes me up for lunch. He says, I've got to know what you're doing. So I told him, and he was thrilled. And he said, come to the graduate conducting class and fix them. I said, well, I don't fix people, and I'm still learning myself, but sure. So I started going to master classes with other students. And then in short order, after all the conducting juries were in, everybody turned around and said, right, we need this in the curriculum, because it was really clear that the kids that had this somatic foundation, especially the beginners, they were just going ahead in leaps and bounds, way, way, way ahead of the others. Now, the body mapping doesn't account for your musical intelligence, right? But it sure makes it possible for a lot of information to be just, and a lot of muck to get cleared out of the way. So that's how it happened. And I mean, they're still teaching those concepts. It's fundamental to everything I do with my choirs. I don't open my mouth or lift up my hands without doing some form of mapping with my students. And to the point now where I actually have to stop and think, what's conducting technique and what's body mapping? Because for me, it's all so integrated. But it was initially, it was because I was worried about myself, and I felt deficient as a conductor, and I felt that there were things that I needed to do better. And I came back from a 7-day tour with 10 concerts, and I didn't have any pain. I felt fabulous. And I've got so many colleagues that have had to leave the podium because of pain. And I just thought, okay, there's something here. There's something here. So that's a sort of long, short version, but Yeah.
Thank you, Doctor. Thank you, Heather.
Heather, Max, please call me Heather.
Thank you, Heather, for that story. That are just here telling your story. I think for some of us that really resonates for us, and probably inspires us to continue this journey. So I think it's time we should start with the session. Heather, please know that we're starting a little bit late, but you take the time that you have. We have some flex time between this and your next session. So I want you to feel like you have time to spend on this very important subject. I want to remind all the participants just to make sure that if possible, if you could turn your video on so Heather can see you, so we can all see each other if it gets to that, so we can see our movement. And then also there is as people leave and enter the room, you're going to see a bar above Heather's screen. It's just a byproduct of this, and we're going to try to get rid of that bar as soon as possible. And hopefully after a while it'll be done, and you won't see it the rest of the session. So thank you. That's it.
You're welcome. Okay, good morning, everybody, and thank you. I know it's early for you, but it's 11:35 here on the East Coast, and we have a beautiful low mid-60s, brilliant sunshine, and my husband's closing the pool. So damn it, it's the end of summer. So I'm in here in grief while he closes the pool, but it's all right. The hot tub is open. I'm going in there tonight to celebrate. And I hope you've read the chat, because I've asked you all to have some fun with this session. Let's air some dirty laundry, folks. I think we know each other well enough. You can call me Heather now, right? You've stayed the course long enough. You've earned the right. So let's talk about some of the myths of breathing that you've got. And I think the fastest and easiest way to do that is to put it in the chat so I can see quickly what you're coming up with that will tie into what we're going to do today. And while folks are doing that, I'm just going to show you a couple of reminders. I actually have some mini models, and I'm realizing that in the virtual world, my mini models are probably actually more helpful. So I've got my little, and I'm just going to I've got my camera here. So here's my mini arm model. So how many of you actually went and really mapped your glenohumeral joint? I know the yoga girls were looking at the humeroscapula this morning. And how many of you are really clear about how the collarbone and the shoulder blade connect together? And how many of you are really enjoying longer arms this morning, right? Because you've now got that sense of the full arm. And I just thought I'd get my arm model out again, just to show you how incredibly long and beautiful arms really are. So be really thinking about sternoclavicular joint. We didn't get a lot of time to go into all of the different rotations that happen. We've got collarbone and shoulder blade that rotate over the arm structure. We've got how we can rotate in that ball and socket joint. And then of course, we've got the rotation of the radius around the ulna. And in a conducting class, I spend a lot of time working on those. In conferences, you kind of got to pick and choose your battles, right? But I hope that will whet your appetite to come back and do some more. I'm actually working on a week-long intensive conducting class that would be somatically based. So people could integrate body mapping with conducting and do all of that. So if people are interested to know more about that, I'll be happy to pass the information on to Max and let you know when that's taking flight. How many of you were playing around with your pelvis and the knee locking and those places of balance? Yes, right? So here's my little mini pelvis model, right? So you're wanting to make sure that you've got your pelvis at neutral. You don't want to be in duck butt or tuck butt, right? And you've got a really great opportunity to sit there today and practice that, right? So try to get yourselves up and over your thorax, right? Get the thorax up and over the lumbar rather, and get the weight of your upper body into those sit bones. And actually you'll find that the neck can release quite beautifully when you're not sitting back or trying to hunch forward like this. And just get yourself kind of comfortable and notice how enjoyable it is to not have to work at being upright. That uprightness that we're enjoying, right, is a lovely offset of the weight of the head being delivered into the core, right? And the force of gravity is offset by that beautiful balanced alignment. So and then every 10 minutes, find another place to be in balance. You can do it, right? Many places to be. So move around, shift around. If you get to the end of the session and your body feels rigid, then you know you haven't had enough micro movement and you haven't been shifting enough. So just play with that and see what you've got. I would just like to remind you about your AO joints, right? So let me move this here. Yep. So here we've got the occipital bone. Here we've got the atlas, and we've got that lovely rocking. So just, if you haven't done your morning stretches, feel free to do them while I'm talking now. You know, in a real face-to-face session, I always take the Saturday morning temperature reading, and sometimes we just do a little stretch and a warm up. Remember, don't rotate your head. No circles. No, 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 no. You want to go forward, back, side, side. Remember, 10 seconds each direction, 5 seconds for the recovery. And you can use your arms to add a little weight if you need, as I like to say to my students, a bit more bang for your buck with that stretch, because the stretching shouldn't feel comfortable. You want to challenge the fascia. So there's going to be a tingling or a burn that lets you know that you're really going farther enough. I promised you some books. So this is the book that I'm referencing in the presentation. It's called The Structures and Movement of Breathing. And don't worry, there'll be a list of all these references for you at the end of the conference. I'll make sure of that. We've also got What Every Singer Needs to Know About the Body. I don't have my 4th edition yet because it came out just at the beginning of the pandemic, but this is the 3rd edition. And it's still very good. The 4th edition will be absolutely wonderful. And this is the newest breathing book that we have in the body mapping world by Bonnie Drainer. It's called The Breathing Book, and that's a Mountain Peak Music publication. So I just have those there to show you that there are plenty of resources. Right, let's have a look at some of the great urban myths of breathing. And oh my God, you have to promise me that I can have permission to keep some of these, because these are hysterical, right? So breathe like you have a belt of noses. Okay, so if you've got kids who are really literal in how they interpret information, right? And there's plenty of them out there. What the hell, right? Breathe through your bottom. Okay, that is my absolute favorite. I have breathe through your feet. I thought that was pretty extreme, but breathing through your bottom, well, that's nearly as good as like, now make sure you've got the breath down here. As I like to say to my students, you can have air down there, but it ain't helping you breathe. And there's only one of 2 ways that's coming out. Right. Breathe from your toes, breathe from your feet. Yeah, we've all heard that one. Okay, Janet, we're going to have a field day with this one today. Breathe through your diaphragm. Oh, good. Goody, goody, goody. I'm so glad somebody came up with something weird and wacky to do with diaphragms. Because by the end of today, you're all going to be converts to balanced breathing. Now, what's this stomach breathing, stick out the stomach? Oh yeah, I was the world's best belly breather because I had a voice teacher that held up a mixing bowl one time and said, "This is your diaphragm." And I thought that all that belly movement was the diaphragm. So I'm pushing and pulling. I had the best belly breathing technique. And that's of course reinforced by yoga teachers that say, now breathe into your belly. Like that was one of the reasons I had to quit the yoga studio I was at. The woman's physiology was so wrong. I just couldn't relax. I just wanted to strangle her. So yeah, this idea of sticking out the stomach, we're going to stop that today. Practice your breathing every day. Well, yeah, I know. I mean, maybe practice cleaning your teeth every day too. I mean, how is that helpful, right? Body mapping's like oral hygiene. You can know all there is to do it, to it, but unless you're actually putting it into practice, it's not going to help you. So yeah, I'm not sure what we mean by practicing your breathing. I'd reword that to say, map your breathing every day. And by the end of today's session, I hope your takeaway today is that you're going to know with utter clarity exactly what you do and don't control when you breathe. Keep the shoulders down to breathe through the diaphragm. If your shoulders move, you aren't breathing with your diaphragm. Brenda, that's brilliant. That is my second favorite of the day. That is wrong on so many levels. I just love it. Okay, so let's start with let's air a little bit more dirty laundry. Why do you think there's all this wacky information out there? Where did it come from? How many of you picked it up from your choral director somewhere in your life, right? How many of you maybe picked it up from a voice teacher? I think the only thing that voice teachers agree on is that the air goes in and the air goes out. And I have used that line on voice teachers at the International Congress of Voice Teachers, and they loved it. They thought it was hysterical because it's true, right? What happens in between is the subject of debate. And, you know, fair enough, I get it. The reason that there's so much confusion about breathing, in my humble opinion, is that much of what we do is intimate. It's experienced internally. And until we had the benefit of modern science, which can actually clarify, and I'm going to show you some videos today to do just that, until we've really had the benefit of knowing exactly what's happening on with our anatomy and our physiology, we've been relying on people to describe their experience. So, you know, I worked with a woman who would teach her students to sing from their vaginas. And that was just really weird, because what were her male students going to do? Right? So, yeah. So how about we stop with the crazy analogies and the weird ideas about what's actually happening? And how about we actually find out what's happening? And I'll go you one better. How about we capitalize on that? So instead of imposing artificial ideas of technique, and there are plenty of them, and every voice pedagogy textbook is full of it, right? How about we try a really radical idea? We figure out what the body does naturally and beautifully, because breathing is an involuntary action. And why don't we just capitalize on it? Like, how easy would that be? It's actually that easy. And it's that difficult, because what you've got to remap is your brain. You've got to stop getting in the way of what your body's doing beautifully when you're not actually thinking about it. So here's the difference. At the moment, you're all doing what I call passive breathing. You're just sitting there hanging out. When you sing or you exercise, you're doing active or forced respiration. And that's where it gets interesting, because in those situations, we then think, oh, right, now I've got to do stuff, right? And again, we were all told that being a musician was hard work. So how many of you were like me and you decided I was going to work harder than everybody else? And in the course of doing that, you ended up maybe getting in the way, right? Because how many of us are A-types? Right? Unless you're at a jazz conference, pretty much 3/4 of the room are A-types. And how many of us, you know, really wanted to be that eager beaver that went extra? So when the teacher said, sit up straight, you made sure you were sit up straight. And when they said, pull your head up by a string, right? Your head was on the damn ceiling, right? Well, no more. Just teach the truth. Just make it easy for your students to access their physicality so that they can then communicate musically. There is so much to do on the page. We don't need to make our body use any more difficult. So with that, I am now going to try the screen share, and I'll see you on the other side of the screen share, everybody. So good morning and welcome. And today, and I'm admitting Stephen Kendall as we go, we are now going to talk about breathing with ease. And there's our little slide reference. Whoops, somebody's on. So let's see if we can get everybody muted. Okay, so Eric and Max, just to confirm for you, I am unable to hide the floating meeting controls. So that's obviously how it all got set up originally. So I'll just do my best to try and not get distracted by that and let you guys take care of it. Okay, everybody, so let's move on to talking about the singer's breath. This is a quote from what every singer needs to know about the body. Singers are not average breathers. We breathe to sustain tone as well as life. Once you understand the truth about the anatomical structures used in breathing, the process is less mystifying. Then you can make choices about breathing techniques based on your own body's truth. And this is important, folks, your body's truth. Get to know thyself so that you can make the right choices. For singers, this is vital because the breath is our power source and we must be able to use it efficiently. Our breathing must be so well mapped that it expresses every nuance of our emotions. It is at the core of our artistry. I would also say to you that, and we'll just come to this next slide while I'm doing that, that breathing is actually about recycling. So for those of you who are into environmental issues, we're the ultimate in recycling, because the exhalation is a waste product that the body needs to expel. As singers, we do something incredibly beautiful with it. And if you can kind of think, I think, more about the practicalities of breathing, it won't muddy the waters with the expressive information. Too much about the techniques that we use as singers get conflated with expressive or musical concepts. And I think it's very helpful to be able to separate out the technique and things that are just literally movement from the expressive, so that you can then bring them back together and have them prioritized correctly. This slide is to remind you about balance and breathing. And I've got two pictures here to remind you about seated and standing balance. So while we're working today, I want to see if in your own home, you can work for optimal alignment, organizing yourself around your weight-bearing, weight-delivering spine and legs, or sit bones if you're seated. And I would really encourage people, if you feel the need to stand at some point, do it, right? Every 10 minutes, you should be shifting your position somehow. This next slide is quite provocative. How clearly and accurately can you describe breathing for singing? Because we're not together and where we have a time limit, I'm not going to stop the share and spend half an hour listening to everybody describe it. If you could just go with me, I can tell you that from many years of doing this work, very few people can actually do it. Some people come close, but it's so long that after 15 minutes, people's eyes are starting to glaze over. And there's been so many sort of misfires along the way that the real answer is very few of us can do this. And yet it is an imperative. So I'm going to teach you about balanced breathing. And I'm going to teach it to you from the perspective of what the body does beautifully and naturally. So we are going to capitalize on the involuntary actions and write this down in your notes. Cooperate. Cooperate with what your body does instinctively. And in this way, we can avoid excessive force and tension, which are two of those three enemies to fluid poised movement. So what is breathing? Balanced breathing is wave-like movement from top to bottom on inhalation and exhalation. And when we breathe free of tension, it just feels like a single movement, top to bottom, coordinated and sequential. Right about now, again, if we were in the room together, I would see a few people who are really thinking about that. And their faces would tell me that they don't believe me. They believe that we have movement from top to bottom on inhalation. But how many of you are confused about movement top to bottom on exhalation? If you believe in the air moving bottom to top on exhalation, you will definitely be confused. And you're in the category of what we call filling fantasies. And I'm going to explain that away in just a moment. When we say balanced breathing is a wave-like movement from top to bottom, we're talking about the structures that move air. So let's see what those structures actually are. And what we're going to focus on are the primary structures. When we breathe, there is movement in many, many, many places. It's actually a very complex process. But when it comes to active breathing or forced respiration, we really only need to focus on the following four elements. So here we go. Inhalation sequence. The first structure I want you to think about are your ribs, swinging up and out, okay? In combination with the ribs, the diaphragm. While the ribs swing up and out courtesy of our external intercostals, the diaphragm descends. Our abdominal and pelvic viscera do not need to move actively on inhalation. All they need to do is be moved by the diaphragm. So the actual abdominal muscles themselves should be out of play. On inhalation, they serve no purpose. Our pelvic floor, which is the group of muscles on the lowest part of our body, are pushed downward by the pressure of the displaced viscera above. So when we look at this inhalation sequence, and this makes sense, right? We're thinking from the top to the bottom of the body. We've got ribs and diaphragm working together to get the air into the body. And then we've got abdominal and pelvic viscera and the pelvic floor being responsive. What I'd like you to just think about for a moment is a little tidbit about the diaphragm. You can't control your diaphragm. Not in the way that you can control the intercostals that move your ribs. So if you hold your breath right now, you're controlling your diaphragm. And that's not helping you sing. All you can do is create the conditions that allow your diaphragm to go on its optimal or maximum excursion. But the diaphragm itself is an involuntary muscle. You only get to control it by interfering with it. So what can you control in this sequence? The answer is ribs. And we're going to get into a great deal of information about that in just a moment. Who's ready for the exhalation? So what happens first? If you believe that the movement is from the bottom up, you're rooting for the pelvic floor. But in actual fact, it's ribs swinging down and in because of the internal intercostals. The diaphragm does nothing on exhalation other than release. When we're doing active breathing, our abdominal muscles will engage with our ribs to help control the outflow of the air. But because of the pressure taken off the abdominal pelvic viscera by the diaphragm ascending, then all of that viscera is able to spring back into place. And the dear old pelvic floor just responds accordingly. So on exhalation, on a controlled exhalation, it's abdominal muscles and ribs that we're controlling together to help balance the flow of air that creates the subglottic pressure that allows us to phonate. Let's have a look at a summary of these primary breathing muscles so that you're really clear. And these illustrations are from the Atlas of Human Anatomy by Frank Netter. He was a physician who was also a gifted artist. And we owe a great debt of thanks to Dr. Netter because he was the very first, and his work is still, I think, the best. Of course, we've now got graphics and animations, and that's all great. But his illustrations show us what we couldn't possibly know in the era before we had sort of voice science. So on inhalation, we've got the external intercostals that elevate the ribs, thus increasing the width of the thoracic cavity. The interchondral part of the internal intercostals also help to elevate ribs, and the diaphragm descends. That's what's happening on inhalation. That's what you have to focus on. Exhalation, it's internal intercostals and abdominal muscles, which depress the lower ribs, compress the abdominal contents, and thus help push up the diaphragm. So some of you are quite possibly sitting in your home right now going, oh my God, how many years have I been trying to do all the wrong things? I had somebody tell me once that on exhalation, I should push my ribs out. But why would you do that when your ribs actually need to swing down and in order to help get the air out of the body? How many of you are now realizing that artificially elevating the thorax is actually creating tension for the ribs? If you haven't figured that one out, you will in just a moment. We're going to try that as an experiment and so forth. So to my point, if you teach the truth, if you give people the facts about what happens naturally and easily and beautifully when we're not interfering, and you then capitalize on that information for the act of singing or doing exercise or any other occasion when you really need to be working with coordinating your breath, this makes a whole lot of sense. Let's talk about how we get the air into the body first. So you need to be aware that your nasal passages are lined with sense receptors that help you balance the amount of air that you inhale for your musical phrase. a problem that I find with a lot of younger singers is that they take in too much air because they're worried about having enough air, and then they're left with air over and they're unable to use it efficiently. So one of the skills in breath management, which is my preferred term, is that we learn how to take in just enough air for what we need, and then we know how to control its release. That is an advanced skill. That takes at least 5 years of continual practice, and it's one reason that people need to practice, because every piece of music is different. And knowing the amount of air that you need also depends on dynamic, on tessitura, etc. In this slide here, you can see that we've got the pharyngeal spaces at the back. So don't just think about your nose as the bit that everybody sees at the front. I need you to think all the way back into the pharynx. So just take a moment and breathe in through your nose and just map the movement of that air all the way back into the pharyngeal space, and then of course down into the trachea. Breathing in through the nose also helps to moisturize the air, filter the air, but in an ensemble that doesn't work. Conductors can do a nose breath like sometimes a sort of a quick rhythmic moment, especially when you're working with instruments. That can be helpful. But having a whole choir breathe together through the nose just adds an interesting percussive effect that probably wasn't thought of by the composer. So you're going to need your singers to be breathing through their mouths. Now let's map the mouth for a moment. It's a nutrient and air receiving structure, okay? And the shape of the mouth, as you already know, changes. So we've got the roof of the mouth with the hard palate and the soft palate, with the soft palate being able to elevate slightly. We've got the facial cheeks at sides, and then we have the tongue from within. So as well as taking air in through the mouth, we also have to think about shape of mouth when it comes to resonance and vowel formation and so forth. I'm not getting into that today because we're just talking about breathing, not diction and articulation, but thinking about how your students have mapped the mouth as a nutrient and air receiving structure is also worthwhile. Now let's move to the tongue, because tongue's, again, very important for articulation, but for breathing, you also need to get it out of the way. So in this picture here, you can see that we have to map our tongue all the way from the hyoid bone to the tip that we have in the mouth. And some of you will notice that you've got some have got longer tongues than others. If you just stick your tongue out, right? A third of our tongue is perpendicular, so we don't even get to sort of experience that. But we need to think of tongue all the way down from the top of the hyoid bone right out to the tippy tip bit that we all see, okay? And again, when we're breathing in, you want the tongue out of the way. It should be just at rest on the floor of the mouth. How many of you have had problems with noisy breathers in your choir, or perhaps even noisy breathing for yourself? One of the possible reasons for that is that people are trying to swallow the air, and they think that they somehow have to suck it in. I think this gets exacerbated by the whole sip in the air through a straw or through a tube, because people think they're going to get a better breath by doing that. There's a reason to do that if you're doing an exercise that's to do with breath management and semi-occlusion, but for just normal respiration, that is not a helpful image to have. So first of all, let's just map what happens. Have a look at the trachea and see the air goes here. So that's right at the front. And you can actually map that trachea. We're going to do that in a moment. Then we've got our esophagus, which is here. Food goes here. And of course, you all know we have the epiglottis, which flips over the top and stops the food from going into the trachea, which is another reason why people shouldn't inhale with a mouthful of food, okay? The pharyngeal muscles are only required for digestive purposes. We use them to swallow, we use them to vomit. So take a sip of the beverage that you have there, or if you don't have a drink, just chew on the edges of your tongue and work up a gob of spit. And I'd like you to swallow. And I want you to map that sensation of the pharyngeal muscles doing their job. Try it again. I'm going to take a sip of water just because that's helpful for me. And I'm feeling the way the pharyngeal muscles help with that digestive function. Air only needs to be drawn through the pharyngeal space without muscular effort from this part of the body. The muscular effort that draws the air in occurs lower in the ribs and the diaphragm. So let's look at tracheas. And I've got a little model here to show you. I've got 12 and 10 centimeters of garden hose to give you a sense of the length of the average adult trachea and the fact that it's always open. So we have these little bands of sea cartilage that are here in the front of the trachea. You can see these bands of cartilage. And as a result of that, the trachea is always open. So let's map it. Take your fingers, find your Adam or Eve's apple, and come a little below it and grab your trachea and just feel it there. Now, let's just allow air to be drawn into the trachea. So what I want you to do is just drop your jaw, open your mouth, and allow air to be drawn through that space without any excessive effort. Let's try that together. And I can do that with a choir of 165 students, and you can barely hear the air move in the sense of hearing a which is what we commonly hear with people who are overworking that. So if you can get your singers really clear that they don't need to be swallowing air, they don't need to be sucking in air, you're going to really help yourself eliminate the noisy breathing. On this slide here, you can see where the lungs are. So let's map the lungs clearly. One of the things that bothers me enormously is conductors who will have their students stand and say, right, let's put our hands down here and let's all breathe low. Because straight away, that's giving students the idea that they've got lungs down there. And as long as they're pushing out down in their abdominal region, in the lower abs, that they must be breathing well. Let's have a look at one of the reasons why that's false information. It's not particularly helpful. So here on the left-hand side, you can see the front view of the body. And on the right-hand side, you see the back view of the body. You can see your collarbones. You can see your shoulder blades. Here you can see your thyroid. You can see your larynx, or the cartilage around it, I should say. And here's your trachea. Okay, and there's the heart just nestled in here. Okay, and now we've got the sternum and we've got lung all the way here. Now, could you just palpate where your collarbones are and track your lungs slightly above, so about an inch above? That's the tippy top of your lungs. I always know when I'm getting bronchitis because I feel pain at the top of my back. That's the first place here. This is where I start to feel the inflammation when I get bronchitis. It's kind of interesting, right? Now, trace this all the way down. So there's the nipple. Come to the base of the sternum and find the base of your lungs. And you'll see that they angle off slightly. The right lung has 3 lobes. Left lung has 2 lobes. And that's because we've got other organs and so forth that we need to fit in there. Okay, we're leaving a space here for the heart. So this blue that you see all the way around, this is pleural cavity, pleural lining. And when the lungs inflate, that is where they go. They expand into that cavity. And you can see we've got more of it here at the bottom than we do at the sides or the top. But the point is that the lungs expand in every direction, but you're just going to get a little bit more of a sensation down. That's why I think a lot of people get hung up on, well, let's get it down. No, the air doesn't work that way. When it comes into the lungs, it's at about this midpoint here where the air comes into the lungs, it branches out. Air is a gas. So when we take a small breath, we're only sort of really activating air into here. When we take a big breath, we're shooting air up here, out here, and down here. So this idea that the air drops low in the body, again, that's a myth. That's a fantasy. We need to think about how our lungs are expanding in all directions. And if you watch me take a really big breath here, you're actually going to see some movement in the upper part of my body that's sympathetic, and some of it the result of secondary breathing structures like the sternocleidomastoid, the scalenes, and so forth. So just watch me take a small breath. And now watch me take a really big breath. And any movement that you're seeing up here is just a natural result of the movement of structures as a result of the air displacing them and the body's need to be able to expand and move further. This picture here might help you also understand. A lot of people think about lungs at front and they're very concerned about movement here up and out, when in actual fact, they need to be thinking about lungs at back and they need to be thinking at the side. So you want to be thinking about the depth. As a graduate student, I sang with the Westminster Symphonic Choir and we performed Benjamin Britten's War Requiem with the New York Philharmonic under the baton of Kurt Masur. And the baritone for those performances and the recording was Thomas Hampson. And we'd come back to campus and voice teacher would say, so what did you learn? Well, everyone in the soprano section, because we were standing right behind him, we could not get over the amount of movement in his back when he sang. The expansion and the excursion was just extraordinary. It was really a beautiful view of a great artist and how he was working just at his ordinary everyday job, but wow, moving the back. And as young singers, with many of us trying to push and pull on other structures, that was certainly eye-opening. But we know that the lungs aren't muscles. That's another myth. A lot of people think, oh, I've got to do breathing exercises every day to strengthen the muscles of my lungs. Well, muscle looks more like the kind of sponge that you use to clean up your kitchen counter, right? In actual fact, the reason that the air comes into the lungs is because of the action of the ribs and the diaphragm. So let's map our ribs to start with. And I've got Mr. Bones here to remind you that we talked about our sections of the spine on Thursday night, I think it was, 7 cervical, 12 thoracic, and 5 lumbar, right? So those 12 thoracic vertebrae, they're significant because at the back, we have all 12 pairs of ribs attaching to the transverse processes of those thoracic vertebrae. And at the front, we have 10 pairs of ribs that are attaching to costal cartilage that then attaches to the sternum. And of course, we've got 2 pairs of ribs, a total of 4 that are here that are our floating ribs, okay, which in days gone by, some people had those surgically removed to give themselves smaller waists. Of course, that was also part of the whole corseting thing. And one of the reasons we now know that ladies of the Victorian era were prone to fainting was that the corset was so tightly brought in that the lower ribs were unable to work effectively in the respiration process. And quite often that caused them to hyperventilate or just have insufficient oxygen. So let's have a look at the ribs here. You can see on this animation the beautiful depth that we have from the side. Have a look at how they're connected there at the back. So when you're breathing, you're actually breathing at those joints on the spine. And of course, we know that cartilage is spongier than bone. So therefore, there's a certain springiness to that cartilage that really helps us with our rib excursion. Now, I'm going to teach you something you can do with your hands to help illustrate for your students what happens with rib movement. So I want you to take your index finger, your middle finger, and your ring finger, and I want you to join them at the front. So that's analogous to what's happening in our diagram here with the 10 pairs of ribs attaching to the costal cartilage. I want your little fingers to hang free so that they are replicating what we call the costal arch, which you see here, right? And then I want you to join your thumbs together at the back, and that's representative of the 12 pairs of ribs attaching to the transverse processes of the thoracic vertebrae. And now I'd like you to try to replicate again, this is just sort of imagery, but it's a way to try and get your students really clear about rib movement. So we want the ribs to swing up and out, and we want the ribs to swing down and in. And I'm going to just move you to another slide while we're practicing that so that you can see on exhalation, right? Our ribs, when we've fully exhaled, our ribs are coming back down to this sort of slender, narrow position. When we're at full excursion, do you see how that they've swung up and out, and there's a width to them? There's also width at the top if you look closely, right? But the greatest width you're feeling at the bottom. And one of the things that's incredibly important to understand is that excursion of ribs correlates with volume of air inhaled. Highlight that one, put it in neon. That's worth of a tattoo, right? So take your fingers or your hands and put them up here, high on your ribs, right up under your armpits. Now take a small breath. Feel that rib movement. Now take a big breath. And you feel that the movement is just greater. Notice I'm saying big breath, not deep breath, because deep breath sort of confuses people and implies that the air's dropping down. Whereas big breath, we're thinking more in terms of overall volume. So I'm very particular about my language. You may have noticed that already, but there it is. Be specific with the language you use so that you're not confusing your students. Now, let's try our experiment with misaligned collarbones and shoulder blades. So let's come to neutral, right? And let's try a big breath from a place of balance. Are you ready? Breathing in. And just breathing out. And I want you to notice how it felt to take that breath. Now, let's try slumping forward. So roll your shoulders forward and collapse your thorax and introduce a little bit of head neck tension through the forward head position. Now take that big breath. And notice how much breath you got, how much movement you got, and how much effort you had to use. Come back to neutral. Try that again. How many of you noticed that was easier and it was quieter? But wait, there's more. Let's go into back row baritone. So shoulders back, take that big breath, elevate the chest, chest high. Now take the breath. Some of you might feel you got a little more air than when you were slumped, but how many of you noticed how tense you are and how much restriction you feel? So come back to neutral, and I want you to really map that rib excursion from neutral. The most important mapping you can give your students with breathing is this rib movement. Again, because when they need to get in more air, they need to move ribs. And most people are so obsessed with their abs, they're not even thinking about their ribs. So breathing in and then breathing out. And if we were doing a controlled exhalation, we would be using ribs and abs. But let's not get ahead of ourselves. Let's go to the diaphragm. So the diaphragm is a basically horizontal structure. It's a thin dome-shaped muscle that spans the entire rib area, and the base of the dome anchors along lower ribs. The diaphragm is the single structure that divides the thoracic from the abdominal and pelvic cavity below, right? So here you're seeing a lateral view, a side view of it. And what I've done is I've also brought with me a coffee filter paper. I've got two ways of showing the diaphragm movement, right? So the first one is if you have a coffee filter paper like this. This is actually nice. It's a little analogous again to the diaphragm. So it's got the dome shape, right? And you've got these little, pleats here, just like you have on the diaphragm. And when the diaphragm moves on inhalation, the central tendon contracts and the diaphragm descends and widens. And then on inhalation, it springs back up. Let me try that again so everybody can see. Breathing in and breathing out, it springs back up. We can do that with our hands if you don't have access to the coffee filter paper. So you want to take your index finger, middle finger, and ring finger, and you want to interlace them to the first joint. Then take your little finger and your thumb and join them tip to tip so that you're making a dome. And now I want you to locate them here at the base of the ribs. So you should already have explored that area there. And I want you to place your diaphragm here. The next slide shows us the actual action. So on inhalation, it descends, and on exhalation, it ascends. So it's going from a highly domed position to a less domed position. It never flattens out or inverts, right? It is simply going from highly domed to less domed. As you can see here, the diaphragm is the principal muscle of inspiration, and it's responsible for 75% of the work. Yet you can't directly control that 75%. All you can do is create the alignment conditions that allow it to function most efficiently. You can control the external intercostals and the interchondral part of the internal intercostals. They're the muscles that control the ribs. So you can control your rib movement. And in fact, when I'm guest conducting, that's the one thing that I do right at the beginning that helps to change the breathing and the sound of the choir by just freeing them all up and getting them to start moving their ribs. The other thing about the diaphragm that's really important is that its movement is felt indirectly. There are actually no sense receptors in the diaphragm. If there were, you would never get to sleep at night. Its movement is felt indirectly by sensing its effects in the movement of other structures. So again, we know when the diaphragm is moving through a good range of motion because we will feel the effect on the abdominal and the pelvic viscera below. And to help you get a very clear visual of that, I'm just going to show you a little 1-minute video clip from 3D yoga that shows you how the diaphragm gains its shape from the attachments and surrounding organs, and how it glides over the vena cava, the aorta, the esophagus, and those internal organs to complete its excursion.
The primary muscle of respiration is the diaphragm. The diaphragm is a thin, dome-shaped layer of muscle and tendon that separates the abdominal cavity from the chest cavity. It gains its shape from its attachments and from the organs that surround it, especially the heart, lungs, and liver. The diaphragm attaches at the costals along the lower rib cage, high in the front at the sternum, and deeply in the back along the spine. The diaphragm also attaches to itself via a central tendon, making the diaphragm one of the unique muscles of the body. The diaphragm uses its central tendon and its attachments as leverage to flatten during inhalation. The expansion of the ribs comes from the resistance of the internal organs to downward movement. As the internal organs are slow to move, the ribs expand to make room for the lungs. While the diaphragm attaches at the bottom of the ribs, its range of motion never reaches that low in the body. As seen from below, we get a sense of the full range of motion of the diaphragm as it would glide over the aorta, the vena cava, the esophagus, and the internal organs. For more information.
And now I'm going to show you a superior or an above view, and this is the inferior or the view from below. So let's go over here. So what do we have here? This is our weight-bearing part of the vertebra in the spine. Here's our spinal C-O-R-D. Don't you love how many musicians spell spinal cord with an H? I think that's so cute. And here we've got our transverse processes, and here's our anterior process, right? And now we have diaphragm anchoring all the way around, all the way around, all the way around. I was absolutely blown away the first time I saw the diaphragm at a bodies exhibit. And it was just so amazing. I didn't realize how thin it was, but just to actually see it there replicated was really eye-opening. And this white bit here is the central tendon part of it. That's the bit that contracts, right? So you can see that here. Here's the central tendon. And again, it's that single solitary structure that's separating everything from above and below. Let's go now to abdominal walls. So we have 4 sets of abdominal muscles that we need to be aware of. And again, I want to caution you against having everybody think, oh, well, when I think about abs, I'm thinking about the front of me here. Well, that's because there's no bone here. But the abdominals extend all the way around the sides and the back of the body as well. In the same way that the diaphragm pushes evenly around the cylinder of the abdominal walls, we have a cylinder of abdominal walls around the whole body. But we're upright creatures and we are forward facing. And most of us are perceiving and thinking very much about the movement here. So I understand that, but I just want you to be aware of not falling into the trap of thinking abs are just at the very front of the body. So we have 4 sets of abdominal muscles, and I want you to trace those with me. Let's start with the outermost layer, which is the external obliques. And they run from the outer edge down into the center of the body. So they're working on this angle. So that's muffin top criminal number 1, right? The internal obliques also contribute to that muffin top drama, right? So from here and out. So internal obliques. So we've got a very interesting meshing of external and internal, giving us this grid-like pattern to start. But wait, there's more. We have the rectus abdominis, which goes from the top of the pubis, which is here, all the way up to the base of the sternum. So that's our 3rd layer of muscle. Whoops, my chair moved too far back. That's our 3rd layer of muscle. Some people call that their 6-pack, right? And it's actually a very important group of muscles in another chain that we use for posture called the rectus serratus. So we really need to be very clear that that rectus abdominis, comes from here all the way down. It's the long vertical length. The deepest layer of abdominal muscles is the transverse abdominis, and that's running this way. So think about this, 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 and this. And you've got this incredible web-like mesh that provides incredible support for the body in all the directions that it needs to be able to move, right? And when we're breathing, we want to show that abdominal wall movement in breathing. You can do it variously. It can be this way. So on exhalation, the diaphragm is descending, the viscera is pushed, and what happens to the abdominal walls? They're moved outward. On exhalation, we're going to engage some of our abs with our ribs to help control that outflow, unless we're passively breathing, at which point they just go along for the ride because the pressure is taken off the viscera and therefore everything just springs back in. Another myth is that if you work out and you'll get muscle bound and that will be bad for your singing. That's just an excuse for people to not work out. Let's now move down to the pelvic floor, which is the group of muscles that lies between the pubis and the sacrum front to back and between the sitting bones side to side. So you can see on Mr. Bones here, right, down in the lowest level, that's where our pelvic floor muscles are. They're interior, continuous with the base of the diaphragm, as you can see here. So here's the base of the diaphragm, and here we've got more muscles, and how we've got our psoas muscle, and now we've got all of these muscles till we come right down here. I put this picture here because I want you to understand that everything is interconnected. Where one thing ends, something else begins. When we are singing, the pelvic floor itself needs to be passive. We're not consciously trying to make it work. The movement of the pelvic floor for singing is the result of pressure from the viscera above. But if you are standing with Disney feet or in a position that engenders a certain amount of tension through the legs and the hip joints, then you're going to make it difficult, if not downright impossible, for your pelvic floor to be responsive. Another reason for good core balance and alignment and delivery into sit bones and legs so that the pelvic floor can be responsive. There's a lot of confusion about the pelvic floor. I told you about people who have tried to describe it variously. These are all descriptions of the pelvic floor from voice pedagogy textbooks. What does it mean to you when somebody says, well, I want you to sing with your movement or your dynamic support? My personal favorite is potent responsiveness. It's also been described as engagement, activity, energy, vigor, aliveness, fire. It's good to know that people are aware that there's some sort of movement there. But you shouldn't be doing a Kegel exercise or gripping to try to make the pelvic floor work. There are some people, particularly I encountered tenors, who are told when you go for the high notes, squeeze your glutes and it helps it pop out. Yeah, that might happen once or twice, but it's not a consistently good way to get free sound. And in some cases could just result in some kind of interesting complications. So the pelvic floor, which is also known as the pelvic diaphragm, okay, is the deepest muscle layer that we're looking at here in this picture. Just so that it's equal opportunity, I'll show you the male and the female pelvic floor. The male pelvic floor is a simpler structure, and it's a slightly different shape. You can see here, there's kind of a roundness to it, and it's not nearly as complex as the female pelvic floor, simply because the female pelvic floor has accommodations for childbirthing. So because of its structure, the male pelvic floor is naturally strong, and the female pelvic floor is naturally flexible. We want to work for the female pelvic floor to get that strength, and the male pelvic floor needs to keep flexibility, because again, the tone of the pelvic floor is incredibly important for the buoyance that we need in our movement, as well as the good health and well-being of organs that are directly connected and related, such as the bladder. So for example, people who are habitually thoracically compressed, you're also putting a lot of pressure on the lowermost organs. So the organ that is next to the pelvic floor is the bladder. So another strong motivator for getting people to keep good alignment is to help take pressure off there and also to keep their pelvic floor toned. When we were not largely sedentary, our pelvic floors got a lot of good natural exercise from the manual labor and the walking and the work that we did. But now, with many of us being sedentary, it's important that we're really exercising that pelvic floor either through our workouts or consciously through Kegel exercises. And I'm happy to talk about that more in the Q&A if you wish. Let's now have a look. Oh, and pelvic floor movement. Let's just try that. So make a diaphragm again, like you had here. And now I want you to just stand and invert it. So you position it here near the pubis. So on inhalation, we've got pressure from above, which allows the pelvic floor to move down. And then when the pressure is removed on exhalation, it springs back up. And if you ever sit on a Swiss ball, one of those big giant physio balls, that's a great way to actually feel that lovely movement. I love the biofeedback that you get from the Swiss ball. There is a coordination between the diaphragms in the abdomen and the pelvis. And it's explained here on this slide. Most interestingly, we've now got, as the result of ultrasound, the capacity to see the beautiful spontaneous organization that takes place between the abdominal and the pelvic diaphragms when we're not interfering. So just for about 4 minutes, I want to show you something that was demonstrated a couple of years ago at a Pilates conference in Denver. They used 2 ultrasound machines, one on the abdominal diaphragm and the other on the pelvic floor. And what they're trying to show here is what they call the hydraulic amplifier, which is the relationship between the abdominal and pelvic diaphragms, and how when we use the breath well, the relationship here and the spontaneous organization allows the pelvic floor to naturally respond to the breath when things are not overly tense or we're trying to overly recruit muscles, okay? In other words, excessive force or tension is going to decrease the relationship between the pelvic floor and the diaphragm. So let's have a look at this little video clip.
Hi, my name is Brent Anderson from Polestar Pilates, and I'm here with Hadar Schwartz from Israel, a colleague of mine in the physical therapy world and research world and Pilates world. And we're here at the PMA conference in Denver, Colorado, the 2015 conference. And we're excited because we actually are spoiled with two beautiful ultrasound machines. And we're able to sort of test the waters on some thoughts and some philosophies we've been teaching for a long time, particularly about the hydraulic amplifier and the relationship of the pelvis to the pelvic floor to the diaphragm. So what we're going to look at now is that beautiful relationship of the pelvic floor to the diaphragm as we see that inverse relationship of descension and ascension of both. And we always talk about the hydraulic amplifier and this relationship between the diaphragm and the pelvic floor. And one of our interests is to see how spontaneous organization takes place in these areas with breath. So what we're observing now is that as she breathes in, the pelvic floor drops down and the diaphragm drops down. As she exhales, we see the diaphragm rising up and we see the pelvic floor rising up. So we see this real beautiful relationship that we've hypothesized, but it's nice now that we actually are capturing the information with two ultrasounds to be able to do that. The other thing that we're looking at here is just the ease at which the pelvic floor naturally responds to breath. And I think it's important for us to understand that sometimes we over-recruit and we ask our clients to do volitional contraction of the pelvic floor. And what we think we're seeing now is just when people use natural breath is one of the best facilitators of natural displacement of the pelvic floor as well as the diaphragm. In contrast to that, when we see people over-recruiting and over-recruiting the pelvic floor, over-recruiting the abdominal wall, we actually see a decrease in this beautiful relationship of the diaphragm movement and the pelvic floor movement in their normal natural relationship. So tip of the day is if we do a little less cueing on the contraction of these muscles and a little more cueing on breathing and natural organization of the spine, the column, the rib cage, the pelvis, I think we're going to see a much healthier pelvic floor and diaphragm.
What I would do if we were together is now ask for 4 volunteers to come up. And we're going to try a little 8-handed breathing demonstration so that you can get your students absolutely clear about the way the structures interact on inhalation and exhalation. I had volunteers from my students, and 2 of them are here today, Alexa and Eric. So we're going to watch a little video now. It's only about 3 minutes, and it just shows you how these structures interact. I will tell you that none of the students had been coached previously. I literally said, come into the choral room, stand there, I'll tell you what to do. And that was good because you actually see me correct or clarify a couple of things, which is also an important part of the learning process. So this is 8-handed breathing. And if you would like to try it with us in your little Brady Bunch windows there, I would encourage you to do that. It's a fun activity. Sometimes my students like to do it vertically. So we get a really tall person for the ribs and someone kneels down to be the pelvic floor, and we replicate a giant human this way. It's great to help your students get really clear about what needs to happen. Okay, so here's our 8-handed breathing demonstration. And I'm going to introduce you to our models. So here we have Alexa, who's going to show us the rib movement. So Alexa, would you show us the ribs swinging up and out on inhalation and then down and in on exhalation? Beautiful. And here we have Noelle, and she's going to show us the diaphragmatic movement. So the diaphragm descends on inhalation, and don't let it flatten out though, darling. Yep. And then back to its highly domed. Good. Do that one more time. That's a good moment there. So from highly domed to less domed, perfect. And then on exhalation, back to highly domed. Excellent. This is Eric, and he's going to show us the abdominal walls. So just move your hands a tiny bit lower, Eric, just a tiny bit. Perfect. Right, so on inhalation, the diaphragm is pushing on the viscera and the abdominal walls expand out. And then on exhalation, we want to use those abdominal muscles with the ribs to control the outflow of the air. Beautiful. Try that one more time. Breathing in and breathing out. Beautiful. And this is Q, and he's going to show us the pelvic floor, right? So on inhalation, the viscera is displaced and the pelvic floor descends. And on exhalation, the pressure is taken off, and then the pelvic floor responds by returning back to its neutral position. So let's see what that looks like when we do a passive breath, which means we're going to breathe in over a count of 5, breathe out over a count of 5. So guys, can you see each other to coordinate? Okay, so on inhalation, we're going to see those ribs and the diaphragm working together to draw the air in. And then on exhalation, we're going to see the abs and the ribs controlling the outflow. Are you ready? On 3. 1, 2, 3. And exhaling, go. Let's see if they can coordinate that together. So Alexa, we need a little bit more obvious rib movement because the ribs are really driving it, okay? So here we go. Let's try it again. Let's do it. I'll count out loud to make it easier for you. 1, 2, go. 2, 3. Beautiful. And then exhalation. 1, 2, 3, 4, 5. Good. Now, what would a singer's breath look like? So we want to get a quick inhalation and then control that exhalation. Are you ready, guys? So we're looking at each other to coordinate. Are you ready? 1, 2, go. And exhale. There we go. Good. And I should add that some of them haven't done this before, so this was literally just sort of a little spontaneous demonstration to show you what it would be like for people who are largely hearing this information for the first time. And you also saw 3 of the 4 of them wearing the singer's resonance masks, which I'm happy to talk about if anybody has questions about those. Now, we're almost there, but we've got just 2 more quick concepts to confirm. One of them is the gathering and lengthening, which I talked about a little last night. So on inhalation, the spine gathers, and on exhalation, the spine lengthens. And that's primarily because of the attachment of the ribs to the vertebrae, so that as we're moving up and out with the ribs, that facilitates a gathering of the spine. And then on exhalation, the ribs swing down and in, and the vertebrae are going to move away. This is a natural movement, and it's part of the buoyancy that we can experience in our bodies. And interfering in it results in labored breathing and limbs that are tense. So for those of us who are conducting, as well as those who are playing instruments that don't require air, like pianos and stringed instruments, you really need this lengthening phase to provide support for your limbs. As I said at the beginning, this is an involuntary movement. Cooperate with it. So I'm going to show you, again, I would demonstrate this for you in person. So here's a little video of me doing some gathering and lengthening a couple of days ago, just to show you the deep sensations of breathing that are activated through this spinal movement. And what you're going to look for, and I'll narrate it as we go, is you're going to look for the movement in my head. So here I am breathing in and breathing out. Do you see that rocking motion that happens? Because I'm on the ball, my body's grabbed onto the ball, and now that highlights what we have. So I think I did about 3 breaths with as little tension as I could get on a Thursday afternoon.
Now adding tension.
Now I'm adding tension to my neck and to my back, so you can see me tightening up a bit. And you have a look at the movement. There's still movement, but there's much less. And had I added more tension, I could have got it to the point where you virtually saw no movement at all. And now I'm going to demonstrate for you again.
Releasing tension.
With tension released. And you see most of the movement at the head because the head's on the end of the spine, right? So when you breathe in, the ribs swing up and out, the head draws back, and then on exhalation, it releases. We call that a ball drape, and it's a lovely way to also help release the neck if you're dealing with neck tension. So the up and over movement that is so highly prized in singing is something we experience with the movement at the skull at that AO joint there, right? So the whole skull is going to move, right, if we have a neck that is free. Interfering with this results in labored breathing, and conductors who inhibit this movement create tension and compress the ensemble sound. So again, what your students see will invoke a lot of what you get. And it's important that they're seeing freedom and a role model that enables them to do the same with their bodies. So what do we do when we need to support the body? In the first instance, we want to get the support of the floor or the seat. Then we're going to look at using our structural support through the skeleton, a body that's aligned and free. We're going to have a spine that's gathering and lengthening, and a good chance of that if we have freedom in the skeleton. We've got rib excursion, which helps to provide support for the sound. We've got the springiness of the abdominal walls, which is part of our support. The movement of the pelvic floor is also a crucial part of the support. And everything from the skeleton down through the pelvic floor is something that we experience at our core. So we conclude with mind, body, spirit, music. Again, embodied and expressive. We use the thought patterns of the mind to control the movement of the body. And those patterns are formed in neurological networks called body maps. When the mind-body relationship is in sync, it then makes it very easy for the spirit and the music to communicate, to be free. The music itself is complex. We need every resource available to address that without inhibiting what we're trying to get at because of tension, excessive force, or misalignment. So it's really up to you. You know, if you want to be physically grounded and have a powerful means by which you unleash your voice and your spirit and your musical imagination, then this is something that is going to work, and it's going to help you and it's going to help your students. Without this, our potential is trapped in a body that's ill-equipped to express the passion and the emotion of music. And that is actually the second reason that I got into this work, because I could see it in students and I realized that it wasn't enough for me to be able to do this myself. I wanted to be able to teach students how to access and maximize their potential. So cultivating the ability to be truly free in music making, from my perspective, is made possible through the body mapping. Again, the references, these are the same ones we've been looking at from the last few nights, and I will have a handout for you all that I will, PDF that I will give Max, that summarizes this plus the repertoire that I'm going to talk about in this afternoon session. I just want to end our screen share here and come back to all of you in case there are any quick questions. And I know we're right on time. Breathing's a really hard one to get through, much faster than that. And every time I do it, I think, am I giving them enough information? I don't want to overwhelm you, but I think I actually feel pretty good about today. I feel like we really covered the most important bases. Max is smiling and nodding. I'm seeing a few of you sitting there going, like, eyes are like this, and that is so awesome, because that means, and I'm going to get to your question, Jim, that's awesome because it means you were listening, you were thinking, and there's stuff going on there. So Max, do we have time for a couple of questions? I'm going to let you moderate the time and just kind of keep me on track so I can just focus 100% on people. So Jim, nice to see you again today. Could you let me know what's on your mind?
Well, thanks for this, Heather. It's so important, and it's such a morass of confusion that the simpler the better. I am particularly pleased that you said a singer's breath can also be thought of as a quick breath. We spend all this warm-up time with a lovely relaxed breath, and then we ask them at a quick tempo to take a breath within the span of an 8th rest. We don't teach quick breathing for singers, do we? We don't. It's not a concentration.
I know people don't, but I do. So what I do, and again, we didn't do warm-ups in this thing, that's another session, right? But I do body mapping at the beginning of every warm-up, and I have one concept that I then connect to what we're doing technically, and teaching the students, and it's very early in the piece, and teaching the students how to manage the in and the out, right? Everyone's worried about getting the breath out, but you're right? Just like, how many of you warm up your choir in a minor mode? Everybody's in 4/4 and everybody's doing something in major, right? and then you go and sing something in D minor. So you're working on Mozart Requiem, warm them up in minor, but teach them the rhythmic breathing. Jim, rhythmic ensemble breathing is one of the first and most important ensemble skills I teach my students. So I am grateful for you for raising that. And again, I teach them the mapping so that we can get at that, because I don't need a symphonic choir of 165 people sounding like they've all got emphysema, right? That's just not attractive in anything. So the more people there are in the choir, the more those problems become problems. So yeah, good. Questions, keep them coming.
There's a question on the chat from Courtney Birch, and it just asks really quick, and maybe at the end you can do this, but can we quickly review the hip alignment we learned Thursday night? So
easy. Yeah, everybody up, let's do this. Okay, so take your right hand and place it on the front of your pelvis. Take your left hand and place it on the sacrum, right? Now look at yourself in a mirror side on. You want to see if you have got your pelvis at neutral, right? Now, what I want you to do is to stick your butt out, so let your tummy sag forward, stick your butt out. Can you see that? And I'm going to come closer, and I think that might help you to see it. So this is duck butt. This is neutral. I'm going to just move my hands so you can see better. And this is tuck butt, right? So duck butt is like a hyperextension. It's where we take the pelvis and we kick it back this way, right? So we get an overarching in the lower back. Tuck butt is where we come under that way. So I often joke that the girls go to duck butt, so they pull their shoulders back and hyperextend, and the boys are all busy trying to look strong and macho, and they go into tuck butt. That's always the joke, right? So you want to experiment with that sensation. And what I will say to you is that if you have been habitually standing with a hyperextended lower back, when you try to get back to neutral, it's going to be uncomfortable. There's going to be some complaints there. So one of the things I do is I get people to, you either get into child pose on a yoga mat, or I get a Swiss ball and I drape over the Swiss ball, right? The first time I did that, I thought my back was going to break. I was so tight and so pulled back because I'd spent a lifetime standing up straight, right? So for me to come out of that, I had to work for several weeks to really get the connective tissue in that lower back area to release, so that I could actually find myself at neutral. Some of you are going to find that, you know, you've got habits of a lifetime you're dealing with. Don't expect information from one session in one conference to undo a lifetime of bad habits, right? You're going to have to take time. And if you want to create a new habit, it's 21 consecutive days. You miss a day, back to day one. Right? And it's going to take you 90 days to make it a lifestyle choice, but it's absolutely possible, right? Y'all clean your teeth twice a day, right? Because it's a priority. So why not body mapping, right? Knowing this information is great, but doing it is a whole different thing, right? So stick with it little by little, and you can be in touch with me and ask questions after this weekend. You're really welcome to do that. Is there a body mapping course that I recommend? If you go to the Andover Educators website, which is www.bodymap.org, it's actually the Association for Body Mapping Education. We changed our name a year ago to the Association for Body Mapping Education, and I've been an Andover educator for so long that I'm still a slip of the tongue there. But if you go there, you will see where courses are being taught by members all over the world. Some people teach them now. With the virtual world, we're seeing more online courses. We have people that do week-long intensives in the summer. Some people like to do them over a series of days in a fall semester. Personally, I love to do the 1 week intensive, because you really get people, capture them, and then you let them run away, try stuff, and then they come back and say, right, I'm ready for more. I've been doing this. I've been certified in this work, licensed in this work since 2002. And I can tell you that every time I teach it, I'm learning something else. So you could do a course every year or two and still be learning. That's the beautiful thing about it. And our organization has a conference every 2 years that people can come to as well. And the next one is going to be in June 2021, and it will be virtual, which is the first time we've done virtual. So that might be something that some of you want to learn about. Max knows me through this organization, which is wonderful, because up until recently, I was the only choral conductor in the organization. So it's good to have colleagues, and it's good to stay in touch. And as I said earlier, I'm working on developing a week-long intensive choral conducting course that will be somatically based. So whereas I teach body mapping to people who do all sorts of things, and I love doing that too, but I'm just itching to really fix conductors. That's something that I'm really good at, and it's something I'm really passionate about. So that's something that I'm working on, and just depending on, I've got a target for August 2021, but that's all pandemic dependent, right? And I don't want to teach it virtually. I want to get my hands on people. I want to see the whites of your eyes, and I'm going to have a choir there so that you will actually be working with real singers who make real sound, who will be responding to the things you do. Oh yeah. Like there's nothing else like it. And so that's why I'm really keen to get this going. So
I would also add that if you are really interested, we have affiliate memberships for the Association for Body Mapping Educators. If that's something that you want to explore, the affiliate membership is pretty cost effective, and then you get access to the monthly webinars that they have, and the newsletters and some of the resources that are available. And so there's a number of teachers in the Northwest that are licensed body map educators. So lots of opportunity.
Yeah, in fact, a lot of this work, Barbara Conable was living in Portland when I first started this work. She was in Ohio, then went to Portland. You've got more than your fair share of people out in your part of the country, actually. And then where I am on the East Coast, we've got a chunk of us as well. I would highly recommend the affiliate, Max. I would highly recommend the affiliate. Get people's feet wet, see what you want to do. Here's the other thing. Don't think you're going to do a course and then become a licensed teacher straight away. That's not how it works. Barbara Conable, when she started this years ago, she said, I've got people that can do this in a couple of years, and I've got people that take 10. Because until you actually embody the movement, until you are absolutely clear about what you're doing, you don't get licensed. And that's what I love about it. It's not like college. Take theory for a semester, great, now go and inflict yourself on humans, right? It's not linear like that. This is far more organic and far more tailored to the individual needs of what you have. So if that gets you excited, I would just really encourage you to talk to Max or myself, or go to bodymap.org and have a look. We've got a lot of things going on there, and who knows, maybe some of you want to do something as a group and you want to have something conducting specific, and we can always talk about that, because the chance to do things with conductors is something that I don't think we have enough opportunities to do. So that could be something for a future occasion. I just really appreciate the comments that some of you are making. I love the humility. When I first learned the truth about this information, my first reaction was frustration. Then I got angry. Then I got sad. And then I got excited. You can't go back in time and blame the people that taught you in the past. And you can't persecute yourself, because you were all doing what you thought was right at the time. You were just all, that was the best. That's all you knew. But the point is that when you know the truth, I believe you have a responsibility to teach the truth. It's not enough to bury your head in the sand and say, oh, I don't want to know about that. When you know the truth, now you have a responsibility to work with it, okay? In life, as in body mapping. So I really encourage you all to read up, to think about what you can do, and just take one thing, take one or two things from what I've taught you this weekend, and try it, even virtually with your students. And I think you'll be really, really amazed if you breathe, if you listen, video yourself working with them as well, and then look back on it later when you're not in the heat of battle. And you'll find pretty quickly. Don't send a letter of apology. You don't need to. All you need to do is make a decision from now on. You're going to teach the truth, right? And I have students who take my class and then they're like, Well, what am I going to do about my teacher who says da 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 da? I'm lucky. I've been around enough, long enough that most of my colleagues at Montclair State send their students to me because they want me to help them. But I say to the students, sometimes it's translation. And often I find that the problem is with the student, that they're hearing what they want to hear. They're not actually understanding what the teacher's trying to tell them. So that's the other thing about the body mapping that's so powerful, is it gives the students a language for actually demystifying what it is that the teacher's trying to say. And I say to my students, you are your own best teacher. It's not the teacher's job to speak in words that you understand. It's your job to go after the teacher and ask questions until you've got the answers that you need to those questions, right? So that's the big thing about the way I teach this. It's all about taking personal responsibility and really getting within the first week, I create a safe space and I get my students really clear that they're in this together and it's about taking personal responsibility. And anyone that doesn't want to do that can walk out the door at any time. They never do, because they're actually relieved to be in a place where finally nobody's pretending, that everybody can be real. And I will say that the work I've done in this area has been, other than what I do on the podium, it is the most satisfying thing that I have the privilege of doing. And it's something that I'm going to continue to work at long and hard, because I believe there's a way for us to stop music being an elitist activity that only a few people can manage. If we do that, we put ourselves out of business. We have a responsibility to make music accessible to everyone, and where better to do it than the choir, right? Choir rocks, folks. Choir, you get the best bang for your buck. Everybody can sing, everybody can be a musician, and they can make music at a higher level than the best person in the group. Bands and orchestras cannot do that, but we can. So give your students the tools. And by being here this weekend, I just thank you for making that investment in yourselves as well, because when you are open to learning, your students will mirror that as well. The day that I think that I know it all is the day I will step off the podium and I will go back to selling shoes. I was really good at that. But until that day, it's all about what else can I learn and grow. And I love learning from my students. Every day that I teach, I'm learning from them. But you've got to put yourself in the mindset to be able to do that. Okay, I really am taking up too much time. Max is starting to twitch. I'm seeing him twitch.
I'm agreeing and I'm smiling because I used to sell women's shoes too, and I loved it. I loved selling women's shoes.
Oh, it wasn't just women's shoes. I mean, these ladies had come in and they just wanted a pair of slippers.